Hello, everybody. Okay, so this is one of my PowerPoints to help you revise for your manicure qualification, and it's also going to recap on the things that we have already gone through. Recapping is always a great idea. So, this is your manicure PowerPoint for your manicure exam, and it also covers your anatomy and physiology. I'd like you to refer to your anatomy and physiology booklets, and you can use this to get your head around the language and also help you answer and label the diagrams for your revision content in order for your anatomy and physiology qualification to take hold after Easter. I'm just recording this just before the Easter break. So we're going to go through the table of contents here. That's the history of manicure, the client care, communication and treatment, massage, products, products continued, products and upsell, and a little secret input of your anatomy and physiology. I don't want to scare you too much. So the history of the manicure is really quite interesting if you're a bit of a history buff like myself. Recent findings have uncovered the oldest manicure set ever found from Babylonian times, dating around 3200 BC. It is apparent that ancient times believed that longer, cared for nails were a sign of wisdom and closer communications to deities. Isn't that interesting? In all fairness, manicures have been around since the dawn of time. During Egyptian times, the hierarchy would have deep colours as opposed to a slave who was allowed to have their nails painted pastel colours. In Greek times, it is believed that the nail was able to give signs from the moon, which is a really trendy process at the moment. People having lunar cycles painted on their nails, and also they have the different stars put on their nails. So, this part of information is actually quite interesting in regards to how we use nail art today. So, they did what we would call a naked mani, which is ever more popular these days. During the early days of Europe and the burning of so-called witches, long nails was seen as rude and inadequate, maybe just another dig at women. However, that changed, and such times now art from the Incas, manicure sets for men and women were encouraged, and the moon manicure was the most popular out of all treatments. Again, you can use some resource if you're interested by clicking on this link below, and it will take you to the reference of where I've got some of this information from. And it's actually quite interesting to highlight here what people think of long nails. It's actually quite interesting in my nail tech years that this is actually still quite apparent. For women we see with really long nails, we do see them as being rude or inadequate. So that's actually quite interesting. So, client care and consultation, you're all very, very well familiar with this process. Always take time to go through the consultation. Take into consideration the client's wants and needs every time. Doesn't mean that they're right, but there's a certain language we can use around this to make sure they have the best treatment. Explain the process and what is going to happen to them. Your client isn't paying for the service you give, they are using it to have some downtime. And you hear me say this in class all the time, some me time, self love, to be pampered and looked after. And this should show through the consultation service. You should really give your client care and attention at this point, and also show your skills and knowledge as a manicurist, as a beauty therapist, to help them understand that not all treatments would particularly suit them, especially in their lifestyle and everyday needs. Always offer a decent cup of tea or coffee. That's the most important thing as far as I'm concerned. Use it within the expenses within your business and offer better than anyone else does on the high street. For example, my clients always have freshly brewed coffee, and I always make sure that I have barista styled milk. And every single time, even you always hear me refer about my daughter, every single time our clients ask us for our special coffee. So it's a really, really nice touch. And it also makes people talk about you. And that is so true, just over a cup of tea or coffee. It's really interesting, the results just based around that for your customers keep coming back. Always add notes to their forms. They may have a wedding or an anniversary or a funeral or a baby coming. This information gives a talking point for the therapist to the client if you're not available. Don't leave your clients waiting. Now, research recently suggests that 5 to 10 minutes shows lack of organization within your business, and this is so apparent. I have worked in so many salons that have been overwhelmed with clients and customers that their clients are sitting there and they don't even know their clients here. We all get wound up when we're sitting at the doctor's surgery for ages, and this is the same thing. They will talk more about what you fail on and how you serve them, more in how good your treatment was if they eventually get it. This part is going to absolutely completely destroy your business because they can just go somewhere else. And there's walk-in appointments in Now and Bartex and Now bars all over the place. So just remember your competition is high. Customer comes first and client care is what gets returning clients. Make notes, take your time and have conversations with your clients about their treatment. Communication is number one key, and a lot of beauty therapists fail on this part, especially when you're first starting out. I already can see the strength in quite a lot of our therapists at college. Ultimately, you want to make sure that your communication is really, really strong. You are not going to be a beauty therapist if you're not willing to talk. So, this is why this job opportunity and this side of what am I trying to say? This part of business was really, really good for me because I just love to talk. So, and I never fail to not talk. So, this is really interesting and really, really strong in how you become as a beauty therapist. So, after the communication, after the consultation, it will give you a good idea and understanding of your client. Communication is key, and being able to move forward with the treatment following your client's decision with the help of your expert advice will show the client you know what you're talking about. This is something I just touched base on earlier. They will feel safe, secure, and most definitely want to come back for more. Showing your professionalism and being able to hold conversations where appropriate is actually what brings your clients back. Multiple times I have heard bad reviews about treatments being carried out, but they have love for their salon and therapist. They want to be your friend, be cared for, and mostly feel wanted. If you can give both, if you can gain both aspects of customer care and communication, as well as give the best service and outcome, your business will be booming. I have sat in salons over and over again because I'm a bit of a secret shopper when it comes to salons. This is my life. I love beauty therapy, I love fitness, and I love business. So all of these things rolled in together has just sort of made up my whole life. And the amount of times I go and do research for certain companies on different salons and things like that. There's so many times I see rubbish manicures and rubbish nails, and I say to the clients, "Why do you keep coming back?" And they say, I just love my nail tech, Kelly. She's awful, and she hurts me every time, but I just love seeing her." And I'm like, wow. So this speaks volume. I would seriously do some research into this and think about how you've experienced communication amongst college. So let's just quickly touch base on the treatment. We sanitize and wear our PPE throughout the treatment. It is absolutely it is absolutely important that you are wearing your gloves and your aprons throughout the treatment these days. You will be checked more from the local council in regards to your PPE at the moment than anything else. We have just got over, so they say, I beg to differ, one of the biggest pandemics since influenza and Spanish flu. So PPE is absolute key, and our industry was hit so hard after COVID. It was nothing to do with our salon shutting, it was the state of some salons. And when the council went out to do their checks to make sure certain salons could open, not only did they have to close down to bad financial management and bad management in general, they also had no grading in regards to their PPE and health and hygiene. So you need to make sure, and you hear me say it all the time, you hear me and see me before you hear me, because you can hear the rattling and rustling of my plastic apron. My hands are dry. That's down to my own lack of care because I'm not putting my hand cream on. But you need to wash your hands all the time. Beauty therapists, it is a lie to say that we have the best hands because we don't. So you really, really need to make sure your PPE is on. And do you know what, ladies? I'm going to highlight the face mask here because even when I'm stressed out, my breath can kick up a little bit, especially if I haven't eaten all day and I've been drinking coffee. It really isn't nice to have somebody breathing all over you all the time. So these face masks really should be worn at all times. It also shows that you've got respect and a barrier between you and your client more now than ever. So really think about that. Then you go on to soaking your hands. As you know, soaking your hands softens the skin and gets the cuticles ready for your work. You're then going to go on to your cuticle work and your filing. You're going to go into scrubbing and get rid of all the dead skin cells. And then you're going to add your paraffin wax or your hand mask. This PowerPoint is all based around the VTCT qualification. There are other qualifications that you actually don't have to have a paraffin wax mask, but this is a very old style of manicure, and I'd like to point out that this is something still very, very apparent in the industry, more now than ever because we're going back to being all natural. So the massage benefits releases joint pain and relaxes muscles, and mixed in with the paraffin wax for a mature client, somebody that's really suffering with arthritis, osteoporosis, or really struggling with blood problems, you will find that the massage and the paraffin wax releases them just for that moment of any discomfort. So the massage medium should be discussed within the consultation. Remember, massage medium, that is your cream or your oil, or maybe they like to have some mixed together. Sometimes people like to incorporate their knowledge on aromatherapy here. I always put smells and aromatherapy oils in my creams and oils when I'm massaging because it just makes the client feel that little bit more comfortable, and they also feel they're getting more for their treatment. Okay, so that's my idea and how I give a massage, which you've seen before. So I'm going to touch base on this because we've been talking about this for a while, and I know you ladies and a majority of people that take my courses and or go to college now, you lot have had the practice of being able to get these products on Temu or Shein, and even my youngest daughter's been doing nails, and she does all her friends' nails from school. And they all use gel polish. So I am a gel polish fan. I particularly love the product, the Gel Bottle Company. And when I'm doing acrylic extensions, I love using glitter bells. I've played around with the products. I've had the products done on me and I bloody love them. However, this is not something that is, the absolute be all or end all when it comes to your manicure. And at the moment, where I'm teaching, we're using now enamel and we're using the OPI system, which I love, but it it has a place again in the industry. Now enamel, now varnish is very, very much back in with vegan friendly products, nothing that smells, with vibrant colors. But now varnish does still give the same effect. It doesn't have a high shine or pigment as much as the gel varnish does. Now enamel, now varnish does chip a lot easier. The top and base coats have got better, but then equally you've got that extended drying time. So, gel polish was invented in the US in the 1980s. The curing processes weren't what they are now. I remember when gel varnish first came to this country, and as a beauty therapist, it was still a nightmare. The gel polish system works with a mix of acrylic monomers and oligomers. They become solid under the UV or LED light. It doesn't chip or lose its gloss like nail varnish does. You can also protect the nail plate more with its hardened surface. Nail varnish is made up of a thinner lacquer-like substance. It dries on its own, and that leads to disastrous outcomes if it's not dry properly. Nail varnish is greater for a quick fix or another option for somebody that prefers just nail varnish. Companies like the Gel Bottle Company do have Peachy, which is their natural, vegan friendly, no smelling, no scent nail varnishes, and their nail varnish option matches their gel varnish option. So, what I do is if I have a client whose daughter and it's her birthday, I always treat their children to a little manicure or pedicure, and they can have the matching colours in the nail varnish as they can do for the gel polish. So that's always another one that you can hit with. Um, I don't think Glitter Bells does that because it's more based around the acrylic. It's more based around the acrylic treatments, but ultimately, now enamel is back in. The Naked Mani is back in. The Naked Mani is the buffed high gloss shine of just some really small prints of nail art on a clear nail plate after a full manicure. So this is where this chic, natural look is coming back in. So products, we've got the hand soak and sanitizer, we've got masks, paraffin wax and scrubs, and then we've got the cuticle remover and tools. In the manicure process, we use the following: cuticle nippers, some of you use knives, scissors, nail files, buffer file, nail prep and dehydrator, and cuticle pushers and blades. Okay, so the upsell. Selling the hand washes and cream is always a strong selling point. This is misunderstood sometimes because people think, oh, you can just go and buy a hand cream or a hand wash from the pound shop or whatever. And you absolutely can. There's been many, many years in my life that I have used Aldi products and Lidl. And again, I love testing products, but they don't have the same effect as what you get when you're having your manicure done. So, this is also something that's really important to think about when you're looking at your selling points. If I ever do a manicure, especially when I used to work in salons, I would always be able to sell the hand wash and hand cream. Always make sure if they say no, it's just a polite little nudge to put the product and display it nicely with the gift bag at the counter, and let them feel and touch and hold the bottle. And they might say, do you know what? I'm going to treat myself to that. I really like the smell of that product. And you're like, yeah, no problem. Always, always gift wrap it and always use some tissue paper to finish off the bag. Here's a little story. I remember a time I worked in a salon, and as usual, I went through my usual never failed sales tactic of selling the hand wash and hand cream, and I needed to make up some commission points for that day. And the so-called receptionist, who wasn't beauty or hair trained, I don't know what was going on. Needless to say, that salon doesn't run anymore. She just got some body cream from Declior and put it on the desk and just said, "Oh, rub your hands with that." The woman was actually going on holiday to a cruise, and to buy stuff on a cruise is really expensive. And when you're working on the cruise ships, the sales incentives are so pushy and so high because the girls have to really meet a high target to make up their wages when you're on the cruise ships. So she wanted to buy the hand cream and hand wash from us to put in a suitcase to take away from her, and it would also, of course, remind her of the amazing me, giving her the best manicure she's ever had. And of course, the sale was lost because she was trying to be sold some rubbish, non-scented Declior body lotion by the receptionist, and I couldn't follow through with the sale because I had to move on to my next client. So always make sure before you start that treatment, your sales tactics are in place, and don't be afraid to try something new. Always do your own thing there. Scrubs and cuticle oils, again, similar tactic to the hand wash and hand creams. It's not up to you entirely to make sure that the display unit and everything is there for the clients, but always ask management or the receptionist, what offers have we got on today? A few salons I have worked at always push the cuticle oil. They can put it in their handbags, they can have it on their bedside cabinet, they can have it on their desk, and we all know how beneficial the cuticle oil is. And the scrubs, inevitably, they can use on their body as well as their hands. So that's another selling point. It's all about the sales. It's all about using the products around your client to get them where they need to be and what they want to treat themselves with. Remember, it's all about self love and it's all about the care and communication. Nail files and massage techniques are also equally important. A majority of people, as you've heard me say, will come from the end of the earth to have their massage done with me. Nobody can massage like me, and that's because it's taken me years and years and years to gain my technique and to gain the routine that I do with a full body massage, whether it's incorporated with lava shells, hot stones, bamboos, God, I do it all, pregnancy massage. And what it is I do no different to anybody else. It is down to the care and attention I give the client. Nail files is always a great one. Giving your client the nail file to take away with them, offering a voucher for bringing a friend next time, or the 5 stamp process will give your client something to think about with a sense of leaving with something for free. So, making a business and becoming a manicurist. Always book your client in for the next treatment, that 4 to 6 week situation. Also, there's online booking systems you can use to take a 50% deposit on there and then, always take your deposit, or the online system will collect their cancelling fee to make sure your client turns up. Offers, incentives, and new leads. Always offer the 5 to 10% off to invite a friend incentive. You're bringing somebody else into the business. Always offer the loyalty card scheme. Offer bundles like buy 4 manicures and now choose any one of these treatments for free, for example. Always offer something to make your client feel valued. Your freebies, you can give away nail files, products with their name on in private boxes for when they return. Hairdressers do this. It shows you respect your client and care for their next treatment. Flip flops, dressing gowns, towels, headbands, spoolies, offers, and VIP days are always to keep your clients loyal. Another thing I used to offer in the salons and when I used to help other managers build their businesses is offer the membership program. And the memberships you can have within the salon, especially if you're linked with a hair salon and other businesses locally, they get to have their own little package put together. So when they used to sign up with one of the salons I worked in, we all got together with management and we put the flip flops, the dressing gowns, a beach towel so they can come out from after having their spray tan done, and their headband. And that little bag was given to them as a treat along with a water bottle because it was linked to the gym and I used to do the personal training, teach classes and do the beauty therapy, so I was like sort of running around all over the place. So I made sure my clients would make use of these products and I would say to them, where's your flip-flops, oh Sally, you've got full body massage followed by your tanning later, have you got your dressing gown and your towel? And a lot of them then started to develop a process, which was quite interesting to watch, where they would pack up their dressing gown and they would call it their gym bag. And then they would pay. That would then give them the incentive to pay for their locker for the year. And they had all their lovely little products all put in their locker and they would spend days with us. So, yes, it was a bit like a health spa where I worked at the time, but it really, really shows the benefits of how people feel respected and they're getting more for their money. A lot of places will say, oh, the dressing gowns cost a fortune. And I don't deny it that they do. But these days, manufacturing is the biggest it's ever been. You can really find some great deals on mass buying for your flip flops and dressing gowns, you see? So there we go. Okay, let's move on to anatomy and physiology. So, bones of the lower arm are as follows: ulna, radius, carpals, metacarpals, and your phalanges. Row, nearest, radius, and ulna. Now, I'm just talking through these, but where you hear me teach, you know an idea about these words and you know and have an idea about this language. So, row nearest, radius, and ulna, the scaphoid, the lunite, let's have a go, triquetrum, and the pisiform. That one I always remember, of course, as you can understand. Row nearest the phalanges is the trapezium, the trapezoid, the capitate, and the hamate. Hamate. Okay. So the lower bone is made up of compact bone and hard bone. and the cancellous, which is spongy bone. These will definitely come up in your exam. They never fail. And the functions of what the lower bone is made up of is to support movement, protection, attachment, mineral storage, that's your bone marrow. I've put that twice there. Let's say it again. Mineral storage and blood cell formation. This is the function of the bone structure of your lower arm and hands. Okay. The muscles of the lower arm and hands: supinator radi brevis, flexor carpi radialis, extensor carpi radialis, flexor. Can you see what's happening here? Supinator, look it up. Flexor, look it up. Extensor, look it up. Flexing and extending. We open and we close. We open and we close. That's what those words mean. Flexor carpi ulnaris, extensor carpi ulnaris, flexor carpi digitorum. Think about digits, fingers, yeah, metatarsals, phalanges, that's where that's all linked. Extensor carpi digitorum, and the brachioradialis, radialis. There we go. Brachioradialis. It's been a while, girls. It's been a while. So, anatomy and physiology types of muscle. We have skeletal muscle, smooth muscle, and cardiac muscle. When you're looking at a multiple choice test, you have an idea that the cardiac muscle is the heart. Function of the muscles: heat production, movement that brings on the heat production, maintaining posture. Very, very interesting. Without the muscles, our bones wouldn't be able to move. This is where we start to learn the process of how our body actually functions. And you get to know it all. Isn't that interesting? So we're going to move on to the nail structure now. The nail plate, the nail bed, matrix, cuticle, lunula, hypernychium, perinychium, eponychium, the nail wall, the nail groove, free edge, and the lateral fold. All right. Growth, process of the nail growth, formation rate, factors affecting nail growth, nail thickness, and effects of damage. Now, you lot should have a really strong idea in how all of these are affected. All you need to do is think about the clients you've had and how to move forward with the consultations you've done. In the different clients that come through that have really weak, brittle nails, their nail thickness is non-existent, but some people's it's amazing. So it's really quite interested in the way the nails grow differently with different people. Functions: protection of fingers or toes, pick up small items, and scratching skin. That's why we have our nails. Now, I've given you a bit of a head start, and I have shown you this diagram, which no doubt you've all looked on Google to answer your A&P book, but this is all about revision, okay? I really want you to look at this diagram. Now, this is going to help you fill out the manicure hand and arm A&P in your books over the Easter break. And I really, really want you to think about where everything sets in the diagram, because some diagrams are really different. So this is why it's so important to remember this language and revise these words. If you go back to the other slides here, where we have some slides that are with words that we struggle with, like I do, brachioradialis, okay, and also accents differ as we go up and down the country. You can type these words into Google and they will give you the speech form of the accent or the way the language is constructed. So that will also help you not only read, but pronounce these words correctly, which will help you ultimately in your revision. Okay. So we've got the free edge. This is where we file and shape depending how big it is. The nail plate, this can get damaged, and this is also the most common part that's damaged when we have acrylic or gel extensions. The lunula here, there should be a nice white milky looking subtle moon, like a half moon, a semicircle at the bottom of the nail plate. This shows us the level of calcium the client has in their body. The eponychium. Now, this part is where we cut away, don't we? We use this part as part of our cuticle work, and sometimes this eponychium is really dry, and actually, for some people that bite their nails, is non-existent. The perinechium can create some dry skin around here and also can create that hangnail if the nails are bitten or cut too short. The nail wall here can be really damaged, and if we don't, for example, again using acrylics and extensions, if we have really or press on nails, if they don't fit properly and they sit on the nail wall, it can really cause a lot of damage to the skin, also infection and swelling. The nail groove is where you really, really want to stay away from when you're painting your nails. What we like to see is a tiny, tiny little thin, nice line. You hear me talk about my lines when we're applying the nail plate. You want to keep it from the nail groove. The nail bed is just under the nail plate. Okay, and this is where a lot of damage can incur if we've shut our finger in the door. You can see some bruising sometimes, or if we're on certain medication and we're sort of lacking in blood circulation, this part here can reflect a really sort of cold blue colour on the nail plate. And then, of course, we have the matrix, and the matrix is where all the growth happens in regards to do to the nail. So as we turn the nail on its side, we can see our metatarsals, our phalanges in and around all the skin and its tissue. Okay, and this is exactly the same. This is just a side view. Now I'd like you to go away and turn to your A&P books and use all of this language now and all of these words that we've got here to help you label that book. All the language is within your A&P books that is here, and we're looking at the bones of the lower arm, the lower bones and the functions of the bones and the muscles. We're looking at the muscles of the lower arm and the hands, the types of muscles and the functions, the nail structure, and, bear with, the understanding of the growth and the functions that I've just spoke about, labeling your diagram, labeling and making sure that you can answer any of the test questions or anything that you have on Kahoot or other resources that are within your platform at college. Okay, so go back to your A&P book now, and you can rewatch this workshop anytime you wish, and you can also skip to the certain PowerPoint slides that you need. Have a lovely, lovely break. See you all soon.